I'm Terry Quinn. I'm a consultant in Glasgow with a dementia research interest, and I'm going to be chairing today. And our speaker for today is Professor Alan Carson. Alan will probably be known to a lot of you. He is internationally known for his work in brain injury, neuro rehab, functional cognitive disorders, but that's not why we've got him here today. He's got leadership roles with all of the important organisations, British Neuropsychiatry Society, Royal College of Psychiatry, but again, that's not why we've got him here tonight. We've got him here tonight because of his editorial roles, and in particular his associate editor role with Journal of Neurology, Neurosurgery and Psychiatry. So the remit we've gave to Alan is to give us an insider's view on how we can get our research published. And I can tell you, I've heard Alan give this talk before, and honestly, it's one of the best talks I've heard. And some of his little pearls are still things that I think about when I'm writing my manuscripts or when I'm doing peer reviewing. So I don't want to use up any more time. I'm going to hand over to Alan now. What we'll do is we'll keep questions till the end. Put your questions in the chat and I'll keep an eye on the chat, but we'll let Alan get through his presentation and then we'll open up the forum for conversation, comment or questions. Okay, Alan, it's over to you.
Great. Thanks, Terry. Thanks for a very kind introduction. I always have a slight fear of speaking on Teams. So if you're not hearing anything or if I'm frozen, can somebody just interrupt me and let me know? But otherwise, I will assume all is going well and all is smooth. So I'm going to talk a little bit tonight about how to optimize your chances of your research being published. Now, clearly, the biggest single factor is doing a good study with nice tight methodology on an interesting question. I'm not going to touch on any of that. I'm simply going to say for the study you've got in front of you, how can you give it its best shot, if you see what I mean? And I'm also not going to touch on the various ethics of publishing or what we think about open sciences, or, you know, should we go away from the standardized model of journals, etc. I'm very happy to deal with that in discussion if anyone likes. My own view on the whole matter, for what it's worth, is we have the world we have in front of us, and everyone I see in senior positions says, oh, it doesn't matter where you publish, we're only interested in the quality of the work, and then they shortlist the candidates who have papers in Nature. So I do have to say that in my experience, there's a gap between what people say they rate and how they actually rate at interview and fellowships. So make of that what you will. Just start with competing interests. It's always an interesting topic in terms of journals, and there is an absolute obsession with financial competing interests. So here are mine. Don't have that many, particularly not with drug companies. I've got to say, in all my time as an editor, but also as a reader of journals, I've been desperately underimpressed by the impact of explicit financial rewards influencing people. There are one or two cases where that's been known to have happened, but my own experience is as nothing compared to the degree of competing interest caused by intellectual beliefs and people's simple belief structure that their pet theory is true and how far they will go to prove it, and how far they're willing to go in unreasonable terms to silence opposition to it. So yes, you should look out for competing interests, but I'm going to suggest to you it's not actually the big issue. So in terms of jnnp, we've been in action for just over 100 years. The journal was started in Queen's Square with a view to bring together neurology, neurosurgery and psychiatry in the one journal, talking about clinical brain sciences. And that's very much the ethos that the journal holds to this day. But they're a funny thing, scientific journals, because they're partly scientific affairs and they're partly businesses, and they're also partly the mouthpieces of organizations. So the JNNP is part of the BMJ group, which is one of the world's largest publishing groups. And essentially, one level you might say the whole publishing group exists simply to make the profit, to keep the BMJ in action, which loses money hand over fist. And the BMJ is wanted as a front piece for the British Medical Association. For those of you who are not familiar, this is the BMA's headquarters and also the home of the BMJ publishing group in Tavistock Place in London. And it's trying to obey multiple masters, the BMJ, because it's partly essentially a trade union newspaper. BMA never like to say they're a trade union, but that's exactly what they are. But it also partly tries to be a serious science journal. And it also tries to be a slightly campaigning journal because it's got the luxury of not necessarily having to make money because all the other journals in the stable underpin it. And it really doesn't matter what journal you care to look at. To some extent, it will be a reflection of its origins, how it's funded, and what it exists for. And to understand that and what a particular journal stands for will actually improve your chances of getting funded. I appreciate for many of you as early career researchers, you may simply look in Medline and look at the impact factors and see a list of journals, but each journal from the inside views itself as having a character and a marketplace and something it's trying to achieve that's not solely about metrics, although that's quite a big bit of it. And the journal teams, this is from JNNP, will tend to be a mixed bag. For those of you from neurosciences background, some of the faces here will be familiar, but some won't. And that's because it's half publishers and half medical academics. And that's fairly typical and fairly standard. And they've got some co-aligning aims and they've got some separate aims. And again, it's worth just understanding some of that. So what does a journal cost to operate? Well, it'll vary depending on its size, scope, whether it does a print edition or not. And generally, it's sort of overall, if you like, impact. I don't mean in terms of impact factor, but in the real world. But it doesn't really matter how it's done. These proportions will exist. There'll be the direct operating costs. What it costs to either return and maintain web servers, or what it costs to produce a print journal. And, you know, all of these things have to have some cost. And then somebody's got to run it, both in publishing and editorial senses. And some of these people, at least, are going to be taking coin out of that. I'm not aware of anybody who's running something completely for free. Even in not-for-profit models, you'll find somebody tends to be paid, and that money's got to come from somewhere. There's usually some cost for promotion, but actually compared to the scope of the businesses, they're generally very, very small. So the JNNP makes over £1 million a year, coincidentally, roughly what the BMJ loses, not that I'm bitter. And yet, you know, for £1 million a year profit-making business, that's not the turnover. The costs spent on advertising are really pretty minimal. But there will also be costs and overheads. Almost every journal will have a set of offices associated with it, or in case of something like JNNP, where we have a large international print run, we also have to have printing presses, etc. And someone's got to be paying for that office space, etc. So that's got to come out of whatever you make. And so you've got to make money to meet those costs, and it's pretty straightforward maths. And that will vary depending on the type of journal you are. So JNNPs as sort of upper mid-ranked neurosciences journal, impact factors around 8.4 at the moment. But it has quite a large traditional subscription base, and that accounts for about a quarter of the revenue. And that's fairly typical for most of the big old traditional journals. And we think very much in terms of a JNNP readership. And again, I think that people aren't always aware of that in the sort of Medline era, but it's still a big part of the business. The next big part of the business is consortia. So every year or every few years, the BMJ publishers will go to various library groups, etc., around the world and say, we will give you this package of journals, and this is how much we want to be paid for it. And there'll be a fair amount of horse trading, and eventually a number will be settled on. But the bigger and more desirable the product, the more they can charge. It's pretty simple. And in order to judge that, librarians, etc., will tend to look at impact of the papers and citation rates, but also footfall for the journal. How many people are using it? What are the altimetrics like on Twitter and social media? How many PDFs are downloaded? So from a publisher's point of view, the kind of global impact of a paper translates directly into hard cash. As I said, often journals are partly paid for from subscription from memberships of societies, and that accounts for some cash. Advertising is actually fairly minimal. It really isn't a big deal. And again, coming back to this issue of finances and drugs and competing interests, I think colloquially I keep hearing people talking about journals obsessed by advertising revenues. To be quite honest, it wouldn't make a blind bit of difference to us if the advertising was removed. It's a really small slither of the pie. Reprints, however, does start to become a big issue. And in the major journals, and I'm really talking New England and Lancet proper, but also to a lesser degree Lancet Neurology and Lancet Psychiatry, the ability to publish data on positive trials and then have drug companies buy up reprints to hand out at conferences of these is a major part of the financial model. So if you to look at one of these major journals, you may see 40 to 50% of the income coming from that. So that is a big issue. And it does lead to a strong bias towards wanting to publish big, large, novel trials, because that really is where the cash is in the publishing game. Open access fees, they make a small contribution, but it's not big. I've got to say, about a decade ago, everyone was getting incredibly frightened about open access publishing in the publishing world and very worried about the impact it would have. Nowadays, just doesn't come up. I think open access, in one sense, has kind of shot itself in the foot. I mean, all it's done is make everyone's emails unusable and led to the growth in predatory journals. And I do think, although I obviously have a bias, that there's a certain degree of being careful what you wish for when there's money afoot. The replacement's not always idealized. People will try to profiteer it. But certainly no one in the publishing world seems to be getting that excited. I know it's a wonderful thing on academic Twitter that people like to go on about, but I'm not sure it's going anywhere. I may, of course, be entirely wrong. But ultimately, the bottom line is journals are business. They want to make money. But scientists, let's not try to pretend we're above all that, are generally ambitious, and they want to make money for their departments. And don't let people kid you, also for themselves when they're able to, and for their career progression. And the bottom line in all this is higher profile journals make more cash for everyone. But the slight complication is to have high impact, it must be something that everyone wants to read. And that's where it gets a bit trickier. So this is an example of a paper that I would say was always destined to go to the Lancet proper. It comes from the time when there used to be a couple of anticonvulsants for epilepsy, carbamazepine, sodium valproate, and it was known that carbamazepine was better for focal epilepsies. And a whole load of new drugs came on the market, and really no one knew whether they were better or worse than carbamazepine. And this was a very nicely run, very well conducted trial. And it answered a question that was of day-to-day interest to me, certainly as a clinician. And that kind of thing will always do very well. And yeah, you don't have to worry about where you're going to publish it. jnnp, we would probably be the journal that maybe go to if the Lancet rejected it, but it was never going to. And we would tend to get papers that are pretty strong, but maybe just not quite as exciting. So the COMET trial basically followed SANAD methodology and looked specifically at where Keppra fitted into this rubric. Still a very helpful paper, still had high impact, still did pretty well. But in essence, I suppose rule one is you kind of got to be able to look at what you've written and think realistically, where is this likely to get in? What sort of level of impact journal is it going to? It takes quite a while to submit a paper. I mean, it's an absolute pain in the backside going through these electronic submission routes. You know, I see it from both sides and I feel the pain. It's ghastly. So I don't see any point in sending a little local audit you've done of 20 patients to the New England Journal of Medicine, because it's just going to come straight back and you're wasting everyone's time, including mainly your own. So try to have a sense of, you know, am I being realistic in where I'm pitching this? And I know everyone thinks, as Arsene Wenger would say, they've got the prettiest wife at home, but just try to be a bit more accurate. So what happens to a paper? Now, these are a genuine paper that I just happened to be reviewing on the day I wrote these slides a few years ago. If you do happen to know any of the people concerned, I'd really appreciate it if you treated that with discretion and confidentiality. But it is just to give you a sense of what an editor sees. So here we have a paper on Daphne, a new tool for the diagnosis of behavioral variant frontotemporal dementia. So very much a clinical paper, interesting topic, very much within the realms of the journal. So it's appropriately placed, and had a quick look and it's well enough written, etc. So that gets sent out to review. And then you tend to get it back. And of course, when you see the reviews, you don't always see every aspect of it. That's point one. But this is kind of very typical of the electronic software that a lot of journals use. So you get met with this kind of message and you get some quick clues, except in this case, one person saying accept and one person saying reject. So you're kind of thinking, well, where are we going to go with this? And some reviews are frankly unhelpful. You know, I think this is quite interesting. Well, why bother really? I mean, it's not, you know, it's not really helping the paper along, doesn't give us anywhere to go. And the other side of the scale is this. It gives some comments to the authors that I think are fairly fair. But often what happens is confidential comments to the editor tend to be a little bit more brutal if one's being frankly honest. And always be aware of that if you're considering appealing a paper or a decision, and I'll come to that later. But this is essentially what you're getting. And as an editor, I then take that to an editorial committee. In some journals, the editor will make a single decision on themselves. In bigger journals, by and large, these things get brought back to an editorial committee, and there will typically be, for us, about 16 or 17 papers to consider, of which we might take 1 or 2 at most. So it is a slightly competitive business. You've got to make your paper stand out. And the question really is how best to do that. Now, as I say, there are just some basics about whether it's any good or not, but there are other things you can do to try and help yourself rise to the top a little. So how can you improve your chances? And it's nothing more than that. As I say, you can't completely change the destiny of a study with anything I'm going to say. It's about communication. Simon Wesley, who gave me a lot of helpful advice when I was younger in my career, well, in fact, still gives me helpful advice now, used to say this was the ultimate headline: Freddie Starr ate my hamster. There is nothing else to read in this paper. I mean, you get drawn in because you kind of have to, but you feel dirty in so doing. But the bottom line is you already know before you begin that there's going to be nothing more to say than what you can see in the headline. And it's clear and it's stark and it tells you the message. And the reason for showing you the journal software is I kind of wanted you to get the sense of how much all the initial contact with the paper is based around the title. Titles are incredibly important, and you get people into the right mindset for opening your paper by how they view the title. Now, again, nothing's absolute, but it just helps. So I'm kind of trying to think a bit as we go to submit our paper. Who are we writing for? Are the editors interested in the sort of stuff you're writing? Has anything like it been in the journal before? If it has, for God's sake, make sure you quote it. Nothing more irritating than having published 5 or 6 papers on a theme in the journal and somebody submits a new one and doesn't quote any of it. What readership does the journal target? How likely are others to cite the paper? All of these things will affect the editorial discussion. And the writing style. Try to remember that technical language obscures communication. So just think to yourself, are you using big words to kind of feed your ego or to slightly obfuscate? Or is it because it's required for that topic? By and large, simple, clear words will communicate the ideas better, and you should try to make things as simple as possible. In that line, avoid abbreviations like the absolute plague. There's a real tendency for people to make up their own abbreviations to describe different groups in a study. It is an absolute nightmare to the reader and hinders communication completely. My rule is you don't use an abbreviation unless it's in utterly standard parlance. So call an MRI an MRI or an ECG an ECG, but anything else, keep away from it. It will not help at all. So as I say, quite literally, the first thing I do is look at the title and the authors, because that's the thing I get shown. Now, conflict of interest here, one of these papers was mine, but the other 2 happened to be in my inbox around the time that I was writing these slides. And just have a look at them and just think to yourself, which one are you already more interested in? They're all on the same topic, essentially. But which one's kind of drawing you in to think, yep, that's the one I would run with? I don't know which ones you chose, but I would suggest that the top one, Depression After Stroke and Lesion Location Systematic Review, is going places that the other 2 aren't. And I think that's because it's got a clarity of message. Even although it's looking at the same topics, it's kind of telling you very precisely and clearly what you're getting. So here's a list just from, again, the week that I happened to be writing these slides in the JNNP of papers submitted. We took 2 of these papers. One's had a couple of hundred citations since. The other one's done pretty well as well. I don't know what's happened to any of the others. So just take a second to have a quick look and think which 2 you might be most likely to take. So I don't know what you plumped for, but some of these things to me are much more obviously papers that are going places. The ones we took were post-traumatic amnesia after traumatic brain injury, pitfalls and challenges. You're getting told that this is a clinical review, but it's on a common problem. Lots of people see it, and it might be very helpful. Whereas the rest of them, public health implications, treatment, antipsychotic medication alone in patient schizophrenia, is just not a jnnp paper. We'd never take papers on schizophrenia. We're at the interface between neurology and psychiatry, so it's inappropriately located, and it's probably unlikely to get much citation. Critical comparison of different biomarkers for Alzheimer's disease in a clinical setting. What this essentially tells you is people have taken the routine data from 2 or 3 memory clinics and stuck it together and are hoping to get a paper out of an audit. So that's going down the Swanee. Cortical brain changes in phenocopy frontotemporal dementia? Maybe. Meta-analysis of modifiable risk factors for Alzheimer's disease? Well, that's already telling you it's going to have big impact, and it did indeed. Posterior atrophies associated with symptoms, agitation, patients, Alzheimer's disease. Well, I'm getting a wee bit bored by the time I get to the end of that title. Post-concussion syndrome, demography and predictors. Well, that's just an audit. Altered striatal functional networks in Parkinson's disease with impulse control disorders might be quite interesting. Cannabis just induced alteration of brain act. Just think why. Error analysis in verbal fluency tasks, patients with chronic schizophrenia. Again, somebody's not read what the journal's about. Parkinson's disease with fatigue, clinical characteristics, pathological proteins and inflammation. Maybe, but it's not the standout ones. So again, just trying to communicate what matters is quite worthwhile. Rule 2, once you've settled on your title, is cut to the chase. If you're writing a paper on a technical aspect, let's say of cognition in Alzheimer's disease, you don't need to write that Alzheimer's is the commonest cause of dementia and it has this rate of incidence in the over 65s. No one is going to read your paper if it's on a technical point who doesn't already know that stuff. It is just a waste of time and it's really quite boring. So cut to where it's at. So again, from the 3 papers on the same topic, I was pointing out titles. Here's the 3 introductions. So background, there's conflicting evidence on the hypothesis the risk of depression after strokes influenced by location of brain lesion. Undertook a systematic review to examine the hypothesis that depression is more commonly associated left hemisphere strokes than right hemisphere strokes, with lesions of left anterior brain than with other regions. You kind of know exactly what it is. Most studies on post-stroke depression have focused on a certain time point instead of time course. Relationship frontal lobe lesions, you're getting a bit bored. And then to examine the relation depressive specific cognitive functions, recent strokes, association. I don't even know what they're trying to do there. I've lost it already. So again, just think about clarity and precision. It makes a massive difference to the readability. There's a basic X shape to any paper. You kind of start by outlining what the general issue is that you're going to talk about. Now, as I say, don't sort of generality. You need to know for what the topic's going to be. And that might be more or less tightly focused depending on what it is. But then bring it in to why the specific question you've asked matters. So, you know, the background to the one I talk about lesion location is there have been some rat studies, you know, that have suggested lesion location influences who gets depression in terms of rats after stroke. These have been replicated in humans, and there's some biological theory about it. But now there's conflicting findings. So is it true? I mean, that's you bringing it in a nutshell. We don't need to talk about what stroke is, etc. You have your precise question. You have your methods that match that precise question. And you have results that match the methods. And then a discussion that starts with what you found, and then with your discussion, you describe what others have found, what the limitations of your results are, and where next. It's quite simple. And again, don't go too wide-ranging. Keep it focused on the area that you've targeted. But make sure at the end of the day, these things all tie up, and you'll be amazed how often when you read a paper, they don't. The second issue is that most studies will raise 1 or 2 points, sometimes 3 or 4. And what I would suggest you do is take highlighter pens in different colors and just check the order you're mentioning them in. So the order they're introduced in the introduction, then the order they appear in the aims, then the order they appear in the methods, the results, and the discussion should be the same every time. So it shouldn't be reversed or interweaved. A lot of language is based on prediction. We know this and test it, the TMS model of the cerebellum for it, if you like. But essentially, if I say to you, Jack and Jill went up you're already waiting for me to say hill. You know where I'm going. If I suddenly say up the banana, you kind of, it gets a bit confusing. And it's the same with a paper. If you keep the ideas very, very rigid and regular, so they always come up in the same order, it makes the intelligibility so much easier. And it's just worth looking at something you've written and just highlight it like this and see if you are getting nice, clear banded stripes, or are you a bit all over the place, and then rewrite it so they all come out in order and just see what it does to the intelligibility. It really does make more of a difference than almost anything else you can do. Now, just try to remember that somebody's got to read it. So this is from one of these papers I've been talking about. Post-stroke depression generally has a chronic course, contributes to a variety of adverse, including increased disability, morbidity, mortality. Systematic review of observational studies indicated depressive symptoms present approximately third at any one time. Prospective cohort study. Oh God. And I'm sort of losing the will to live and wondering where they're going with this. You kind of just wanting to say, oh, come on, cut to the chase. Once you've written something, get your friends to have a look, preferably somebody who doesn't work in the field. And if they don't understand what you're talking about, that's your fault. They may well be thick, but it's still your fault if they can't understand it. Your job is to get it across to thick people, if you think about it that way. Don't blame the reviewer if they don't understand. Blame yourself. And if they look a bit bored and uninterested, that's your fault too. And if you're just giving it to your mum and she says it's great, well, that's not really very helpful. You want somebody who's going to tell you it as it is. Now, one of the things I see a lot is people trying to pretend there's controversy where there isn't. It's an absolute waste of time. If what you've done is a replication study, just say, this is a really important issue. It needed replication. We've replicated it. That's worth far more than trying to pretend that there is some unknown controversial area. I mean, just pity the soul who has to read this stuff and try to find out what they're actually meaning. And, it just isn't going to help you at all. Now, I was alluding earlier to the idea that journals are interested in citations and reading, and that they don't spend much on advertising. So most of the advertising that occurs is informal, peer-led. And one of the biggest places that happens is at conferences. So whenever we publish papers, we hope that researchers will be interested and that they'll present the results to their colleagues in conferences. So most journals will actually provide slide makers to make it easy. So always be thinking, is there a nice graphic illustration that will make a conference slide of the best results? And even if you need to get, for technical reasons, a large, relatively unreadable table in, I would strongly encourage you to also include a graphic. If editors want you to take it out, they can ask you to, but no one ever got a paper rejected because it was a nice, clear summary graphic. And generally speaking, it will help. Avoid to the best of our knowledge. It's not going to save you anything. Just say this was the first longitudinal study. Adding to the best of doesn't make you less wrong. You know, if it happens that the reviewer had done one before, they're going to be angry anyway. They're not going to be less right. It doesn't help. I always remember when I was doing my pediatric finals many, many years ago now, about 30 odd years ago, the external examiner said, you know, an awful lot of people tended to say, oh, I think I'm maybe hearing a murmur in this kid's heart. And he was just saying, this is a waste of time. He goes, I'm going to mark you as having heard a murmur. So if you're wrong, it's wrong. He said, but I'm not going to give you full points because you didn't know if you're right. So he said, you're just on a losing bet. So if you think it's the best, it's the first or the best or the biggest, just say so. And if you're wrong, you're wrong. It's not a big deal. So I was talking about this idea of getting title, aims, methods, and conclusions to line up. And grab a paper at random, and you'll be shocked at how often the aims and the conclusions don't match. So here's a nice clear title. Escitalopram and problem-solving therapy for prevention of post-stroke depression, a randomized controlled trial. Nice and clear, tells me exactly what I'm getting. It's a big issue. Context. Depression occurs in more than half patients who experience stroke. Notice it goes straight to the chase. It doesn't tell us that stroke's the second commonest cause of disability in the industrialized world, etc. Post-stroke depression is shown to be associated with impaired recovery and increased mortality. Prevention is thus an important goal. What are we going to do? So we're getting into this X structure. So that's the open part of the X. To determine whether treatment with escitalopram, an antidepressant, or problem-solving therapy will decrease the number of depression cases that develop. We've got the design and methods, etc., nice and clear. Main outcome measures. And, sorry, I've jumped a thing. In conclusion, this study's demonstrated post-stroke depression can be effectively presented in a significant number of patients by administering escitalopram problem-solving therapy during the first year following stroke. So it's nice and clear, and everything lines up. And that's really all one's looking for. So getting published, it's really quite simple. Do a good study, clearly describe its context, its aims, its methods, its results, and conclusions. I suppose the question I would ask is therefore, why do so few people do that? So I'll finish at that point, and I'm very happy to take any questions if you haven't fallen asleep.
That was brilliant. So thanks, Alan. The floor is open now to questions. While people are thinking, I'm going to ask you the question that you're probably trying to avoid about preprints and repositories of journals that haven't been peer reviewed yet. Something that's became very topical, you know, last year with COVID. Have you got any thoughts on that?
Yeah, I mean, you know, things will go in the direction, but I think it's a little bit problematic. So I was quite involved in the big COVID CNS studies in terms of the national database, and we put our paper, you know, most recent one, through to the Lancet. They publish it on their preprint server, and then ultimately decide they don't want to pursue the paper. So we then have to send it to Brain. Nothing wrong with Brain, very happy to get in there. But you kind of feel that you're selling second-hand car by that stage because everyone's read it and downloaded it. And I'm not sure is the honest answer. I think there is an issue. There are many problems with peer review, but I think it is helpful. I think it does point out fatal flaws that people aren't always aware of. I think it does improve the clarity of papers. And I slightly worry about the widespread distribution of something. And I think COVID's been an example of both the best and worst of science. There have been some fantastic developments at high speed, some great collaboration, some great work. And equally, there has been some utter dross allowed to develop hands and legs because of a failure of going via peer review and everyone rushing to places. And yeah, my suspicion is that on a personal level, I would possibly try to avoid it for work I thought was high quality. I kind of think editors like the big bang of you heard it here first. You know, you never see the news of the world sort of putting out their scoop in the Radio Times the week before. You know, you want to read all about it.
No, agree for what it's worth. So we've got some good questions coming in the chat. And the first one, this is a good one from David. He's asking, how long is it reasonable for a paper to sit in peer review? And I guess kind of a follow-up to that is it worth emailing the journal if a paper's been in peer review for a long time?
Yes is the answer, and yes. I mean, I don't think there is an absolute answer to that. My own view is that 3 months is about as far as you should go. I think there are ways of phrasing it. And what I would maybe write if it's been in for 3 months is to the editor, something generous along the lines of, I know it's difficult to get reviewers. I don't know if it would be helpful, but here are maybe a list of people you might want to consider contacting, and something like that, which sort of, can you get a move on without actually saying, you know, what are you doing here? And often the problem is just trying to get somebody to review the paper. And, you know, it's harder and harder with every passing year. And I'll commonly have to contact 20 or 30 people to get one review. And that just takes time. And a large part of that is the predatory nature of open publishing. So many people get so many letters from fake journals asking them to review or publish manuscripts that everyone works with content deleters. So the biggest problem we have is actually getting somebody to open the email. So as I say, I'm not sure that open access is quite the glory lots of people think it is. But I think that's the best way of going about it. And similarly, when trying to choose reviewers in the first place, a lot of journals invite you to name 5 or 6 reviewers. And I'm astounded that less than half people, I would say, take that option up. Are you nuts? It's your chance to get your paper to somebody who actually understands the field and is going to do it sensibly. And rather than taking up the invite to guide me, you say, I'll make it up as you go along, Alan, and choose somebody. Well, yeah, that's an awful lot of trust. I wouldn't take it. I mean, just are you nuts if you don't take that option?
I guess following up from that, some journals at submission stage have a box where you can recommend people you don't want it to go to. Do you ever cheekily send it to those people?
I don't, but several of my colleagues do, just out of curiosity. So I tend to be a believer in positive behavioural reinforcement, and I only suggest the people they should, just in case.
Okay, and we've got a question here from Una, who is saying, our question is about journal titles and whether you should have a journal title that essentially gives the results of the paper or a more generic title that just gives the method. Do you have thoughts on that?
I don't think there's an absolute answer, and I think it depends on the circumstance. I certainly don't think it's a bad thing to do. The chances are it will attract interest. It's always a little bit of a problem, particularly with a negative study. So, you know, if you're saying this is no good, kind of clears interest. There is, however, also Betteridge's law of journalism, which is any title with a question mark can be answered with the word no. So you do be aware of that too. I don't have a strong view, is the honest truth, and I think you just got to look at what you've got and try and work out. I think short and pithy and avoiding lots of sub clauses is definitely the way forward. And you don't have to mention every bit of the methods. You know, often people want to go into every little bit of it. I think it's enough just to give, you know, this is kind of roughly what you're getting for your money.
Yeah.
But I'm sorry, that's a bit unclear and vague as an answer. It doesn't, yeah, I think you've got to look at the circumstances.
Yeah. And we've actually got a lot of questions in, so apologies if I'm missing anyone's questions. There's a question here from Fraser. I'll just paraphrase it. So he conducted a systematic review, but actually found that there was hardly any papers, and the papers were all a bit ropey. So he wasn't able to create an evidence synthesis, and he's struggling to get that published. And his question is, you know, is there a better way to try and get that published to really highlight the problems in the existing literature?
No. Sorry, I don't mean to dampen your parade, but this is just the reality. If there is no evidence, you're going to struggle, and I think you're going to have to look at a low impact journal to put that out in, and I don't think there's any way around that really. If you want to highlight it for other purposes, you know, the fact that no one knows and no one's done any work, I think that really needs to be done through sort of generic review and editorial work. And that's very hard to get that as an early career researcher, just realistically. We want, and it's all very unfair. And again, I'm not standing up for it or not, but if we're commissioning editorials, we want it from known names, because that's basically what people click on to read. I think the easiest way is to see if you can team up with somebody, you know, with you doing the legwork and them being the name to try and get it in. But I think that's the only way you can highlight it. And it is a problem, because you can spend ages effectively proving that there is no literature on something. But, you know, I think bottom line is, if you can't suck that up, careers in research may not be happy for you, because there's an awful lot of spending ages doing things that don't necessarily lead anywhere. Maybe as well to find that out early doors.
Yeah, it's the story of my life. We've got
the story of everyone's life from Paul Nurse downwards, I think.
We've got a question here from Sammy, who's saying, when you get peer review comments, can you completely disagree with a reviewer?
Yes and no. I think you have to fight your battles, is how I would put it. Basically, most journals will send the paper back to the reviewer. So I think what you've got to decide is this just a completely incompetent review, and you want to write to the editor and say this was an incompetent review? And generally speaking, it's so hard to find reviewers. Editors are going to be sympathetic to the poor sod who's taken time out of their life to write a review. So you really only go down that line if you feel there is no way forward, if you see what I mean, and if you've got something pretty solid. So I remember one paper we appealed for the Lancet, which had a statistical review that was utterly damning. And it was also a bit weird, and our statistician said, that's quite weird, but also I think I've seen it before. And she ran it through plagiarism software, and it had just been totally plagiarized from a book, uncredited. And we just wrote and said, look, you know, we think there's an issue with this review, and we think it's plagiarized, and here's why. And I think if you've got something solid, you're good. Mm-hmm. But what's much more common is the reviewer will have put in 28 comments, most of which are just designed to irritate. Comments like, did you think about doing this with MRI rather than CT? And you're like, yeah, well, I've done it with CT. So that's what you're getting. I can't run these through software that magically makes it MRI. The question is CT adequate? And And it's tempting to just say, you know, what sort of arse are you? But that really isn't going to get you points. So what I would generally do is be very enthusiastic, try to take on board as much of the low-hanging fruit that you can do without completely savaging your paper as possible, with great thanks. And then in one or two areas, kind of sort of not do it, but smooth over the fact you've not done it. You know, this is a very good idea. This study would have been possibly better with MRI, but unfortunately clinical policy was to use CT, as you must damn well know, you moron. But you keep that bit to yourself and just say that's a good suggestion for future research, which avoids actually saying explicitly, just get lost. So I would maybe do it that way. But I think also quite a lot of people just don't really engage with peer review, and not always for the best reasons, and just object to everything. And that's a bit irritating as an editor when you have to send it back and say, well, actually, they've refuted all 52 points from 3 different reviewers.
Yeah.
You know, at that point, you maybe need to look in the mirror and ask if I'm right.
Yeah.
So none of that helps. Again, there's no absolutes.
No, brilliant. So we're getting close to the hour. Time flies. Yeah. Can I finish by asking you a question? One of the things that we're quite keen to do in SDRC, and hopefully this is music to your ears, is try and get some early career researchers trained up in peer review so that they can start to peer review papers. So do you have any hints and tips for people doing their first peer review of a journal article that's sent out to them?
Firstly, accept and do it. And we're very happy to have early career researchers reviewing. We're also very happy to have joint reviews, whereby if it's sent to your lab leader or whatever, that they pass it down to you. And we commonly get them saying this review was done jointly between X and Y, so that Y can be credited with it. And we're happy to credit people. So that's point one. Point two is you don't have to be too long and too pernickety. So I sometimes get 3-page reviews that correct full stops. We pay a bloody fortune to typesetters and print editors to do all that. You don't need to waste your time with it. An ideal review firstly deals with the question of, is this interesting? You know, is this just something you fundamentally want to know? So headline with that. And then really it shouldn't be more than a page long, and it often does not need to be that long at all. What I want to know are the big features. You know, is this methodologically adequate? Does everything line up? Is it justified? Are there areas of lack of clarity? Are there major limitations that they haven't talked about? Do try to resist the temptation to put your own 3 pet theories and your own 4 papers on the topic into the review. It's always a dead giveaway when the same papers with the same author, 4 of them are recommended. We do kind of know what's going on, and certainly I explicitly tell the writers that they can ignore that bit if they wish. You know, I don't think that's fair. It is the person's paper. It's not yours. Your job's just there to try and, you know, help it be improved and to help the editors understand if it's acceptable stuff. And I'd, you know, try to take it at that level. But you do get formal credits now, and you know it is something that you can write and record for CV and career development purposes, and it's things that are asked about in many arenas where you're trying to develop in. So it is worth doing for self-interest alone. But I think it's also interesting. We tend to see others' flaws a little bit more clearly than our own. So do it, take note of what they've done wrong and try to avoid doing it yourself. So somehow it's easier to see it in others.
Yeah, excellent. Okay, well, I'm mindful that I don't want to run too much over the hour. So at that point, I think I would just thank Alan for another brilliant talk. Thanks everyone for joining. At the peak, we had over 50 people with us, so that's great. And I know more people access these talks offline on the website. And I will see you all next month for our next webinar. So thanks everyone and good evening. That was good, thank you.
Yeah, sorry about that. I started to freeze right at the finish, but hopefully got through the main talk. Okay.
On the chat, we're